I did my medicine in France, in Toulouse, the general medicine. My specialty in Montpellier and in Paris. And I was in Minneapolis, in Twin Cities Scoliosis Center. I work with Bradford and John Moe, and the very big specialized people concerning scoliosis. It is Twin Cities Scoliosis Center. It's a very high specialized center for scoliosis at this period. We were doing around 3,800 spinal surgery per year. Actually, I am in Beirut, working in sometime in private hospital, but mainly in governmental hospital, because I like to treat the people which don't have the possibility to be treated in the private sector. And in general, the most interesting cases are in the public sector, not in the private sector. If you use an antibiotic, always, if you want to have a good result, you have to do it in the hospital and IV. If you don't an IV treatment for at least 2 weeks, in general, it will fail. It's sometimes we see chronic case because they were treated by pediatrician, by ambulatory antibiotic, and it's facing a big catastrophe. It's very bad. If you do your treatment into the hospital, followed up by infectious disease, and you will give a treatment by IV, and every week you follow up the white BC, the ESR, the CRP, to see if one antibiotic is enough or two, you will have a good result in general. Start with one antibiotic, not two at the same time or three, if you don't have the germ, because 70% of the time you don't have the germ. But we know that 30% are positive in Staphylococcus aureus or methicillin resistance. In general, it's better to do treatment IV and at least 2 weeks. Some will need 4 weeks. When you have a discitis, in general, you do a standard X-ray. You look at the disc space. In general, always you have a narrowing disc space. If you don't have a clear X-ray because maybe the diagnosis was too early, if it's a little bit late, you can see sometime in irregularity of the end plate of the disc place involved, but it's a little bit late. So you can do an MRI or a scintigraphy and start your treatment. I have several cases like that. Treatment was done without aspiration biopsy and without open biopsy, and we treated as a Staphylococcus aureus patient. In general, all have an excellent result. And future on, you can see later on, several years later, when you do a standard X-ray, you can see a fusion between the involved disc. For example, it's L3, L4, you will see narrowing plus fusion of L4, L5. But there is no consequences at the long term. Pain is gone and everything will be okay in general. Quality of life, in general, it's good when you do an early treatment, depending what was the cause of the limping. I am horrified when I see still today that the septic arthritis of the hip came to me very late. And it's a disadvantage for the family. It's a catastrophe. You can have a stiff joint, a painful joint, or dislocated hip, a plus 8 to 10 degree of leg discrepancy. It's horrible. It's not acceptable today to miss a septic arthritis, really, because it's easy diagnosis, early treatment, and excellent result. We don't have the right to miss a septic arthritis. I would be a human right fighter. Human right fighter to let all the people be equal, not difference of the religion, of the race, and not difference between poor and rich. I am very interested in people as a people. So I would be a human rights fighter.